Welcome to this presentation on sleeping with persistent pain and managing fatigue. What do we know about sleep? We spend around 1/3 of our lives asleep, but there are big individual differences, both between different people and throughout the course of our lifetime. So babies, for example, spend half their days asleep, whereas the older we get, the less sleep we need. Sleep plays an important role for our bodies and minds, both to restore lost energy, for repair and healing processes, as well as memory consolidation. Throughout the course of our lifetimes, it is normal and most people experience at some point in their lives sleeping difficulties. Often they are related to stressors in their lives and subside once these stressors have gone. However, for people with persistent pain, sleep can become more of a problem. And we can see in studies, depending on different studies, between 67% and 88% of people report sleeping difficulties. Our sleep is generally regulated by an inner body clock, which is influenced by factors like hormones, light and darkness, our activity levels during the day, and other factors. What a typical night's sleep looks like. So within a normal night, we have a number of different sleep cycles with phases of light sleep, darker sleep, and in yellow, the REM sleep phases, where we tend to dream more. And as you can see, within one night, we have in the first half of the night more deep sleep phases, which are associated with a sense of restorative sleep, and where the body can repair. And in the second half, towards the morning, we see more of these phases of REM sleep, which is called that way because of the rapid eye movements that we can observe during this phase, even with the eyelids closed. And that's where we tend to dream a lot. And these phases are more associated with memory consolidation, where content of the day experiences get processed into more long-term memory. Now, what has an impact on our sleep? There are biological factors like hormones, pain, an infection, having a cold, a blocked nose can impact on your quality of sleep, but also more psychosocial factors like worries, having a very busy, active mind, having stress factors in your life, unbalanced activity levels throughout the day and before going to bed, maybe unhelpful bedroom environment, and also factors like diet or general lifestyle choices. And we will look into them more closely. So what often happens when people can't sleep is that they can get stuck in a vicious cycle where they struggle with their sleeplessness, where they try to sleep, they might go to bed earlier, they try harder to fall asleep, and unfortunately often end up not being able to sleep and getting more frustrated and worried about their lack of sleep and their ability to function the next day. In our pain service, we use a psychological approach which is called acceptance commitment therapy, in short, ACT. This ACT approach to sleeplessness teaches us that the more we struggle with our sleep, the more we try to enforce and control sleep, the more difficult the problem gets. And so the idea is to try to stay calm and be accepting of what happens even in a difficult night when I can't sleep that much is a really key part to improve your sleep quality on the long term. And one word on acceptance, because often that people misunderstand acceptance as resignation. However, resignation would be a passive giving up. What we mean with acceptance is an active choice to let go of the struggle, let go of the fighting with sleep, and accept the mind's and body's reactions to a poor night's sleep. And rather than dreading it, allowing it to happen. Acceptance is all nice and well, but you might feel right now that, what else can I do to help my sleep? There are a few things you can look at. There are a few tips we have for you that you can check in with yourself, which are called sleep hygiene. So a few aspects around your bedtime routine that you can look at. The first and most important bit is developing a consistent day-night routine. Try to go to bed around the same time as every day and try to get up in the morning around the same time, regardless if it's a weekend, normal weekday. This helps your body to reset your inner body clock. And so your body knows when it is time to go to bed and when it is time to wake up in the morning. It might be worth looking at your bedroom environment. Is it too warm, too light, too noisy? Is it possible to change any of these factors? Also have a look about technology in your bedroom. It might be tempting to stay on your phone or watch TV until the last minute before finally falling asleep, hopefully. But for your sleep, it might be more helpful to, for example, read a book, use the last hour before sleep to wind down, reading, listening to some quiet music, maybe doing a breathing practice or relaxation practice or meditation, something to help your body and your mind to wind down. Also being mindful of your diet. We know that a very heavy meal, spicy, sugary, fatty, or alcohol or caffeine before going to bed can be unhelpful. It might take a lot of energy of your body for digestion processes. And particularly alcohol often seems to make falling asleep easier, but has a negative impact on your quality of sleep throughout the night and often can lead to lower mental health and lower mood and more anxiety the next day. So if sleeping is an issue for you, try to avoid that, particularly closer to bedtime. Are you a busy thinker? Are you a worrier? If you notice that you have stress or worries or just your mind struggles to calm down before bedtime, there are a number of things you can do, you can try and see if they help you. The first thing might be doing a relaxation or mindfulness practice or some breathing. There are a whole lot of arrays on YouTube, or there are also helpful apps like Headspace, for example, which can be helpful, where you can listen to one of these practices and they help you to focus your mind on your body, on your breathing, calming down. Another question for you: are you clock watching? What we mean by that is when you might lie in bed and you can't sleep, and then at some point you check the time and it's 1 o'clock. Getting late. You try again, 2 o'clock, 3 o'clock, 4 o'clock. And the longer it goes, the more frustrated, the more stressed, the more tense you get, the more worked up you feel. And then maybe you've experienced that at 5:30, 6-ish, where you feel like, okay, now it's a bit pointless. I don't need to sleep anymore because my alarm will go off in an hour anyway. That might be the time where actually you fall asleep, because that's the moment where the pressure has left you. So if that's an issue for you, why don't you try to put away any clocks and try not to look at night at the time, but rather say, it doesn't matter if I have half an hour or half the night in front of me. I'll try to relax and use that time for me, to rest, just to wind down, have some time where I don't have to do anything. And sometimes it might even be helpful to use paradoxical interventions. Psychologists sometimes have weird ideas. They might suggest to stay awake the whole night rather than trying to fall asleep. So it's changing the goal. And funnily enough, sometimes that might help you fall asleep. So anything that helps you get out of this struggle. Another way to help you could be schedule worry time. So before you go to bed, or even whilst you're in bed, the last half an hour before that is your scheduled worry time. And me or my colleagues might ask you to really spend this half an hour worrying, trying to bring up all these thoughts that might haunt you throughout the night, that might keep you busy, keep you awake. Try to think about them really hard. If you want, you can even write them down. And afterwards, it's done. You've worried enough, and now you can allow your mind to calm down. Because you've done it, you've maybe even written it down, and this can give you this peace of mind to invite sleep to come. Another factor when we struggle with sleeping is daytime fatigue. So the one thing is the maybe difficult night, but then we also have the days where we might feel very groggy, exhausted, and it can be hard to get through the day. But even then, there are a few things you can do to help you manage it, to help improve your sleep. And remember, on the long run, the more your sleep improves, so does your fatigue. It might be helpful, rather than having a few heavy meals during the day, to have more frequent lighter meals. So your body isn't as busy with digestion and has more energy for day-to-day things that you want to do. Another aspect, get active. So it might be very tempting to lie down, have a nap when you feel fatigued. But instead going outside, maybe for a 5-10 minute walk, where you're getting more daylight, that helps in resetting your inner body clock. And activity can also help to counter this sense of fatigue and grogginess and can re-energize you. I'm aware this is not always easy, but it helps to try to maintain or aim for a healthy body weight, just so that your body has more capacity to help you with these day-to-day activities you want to do and be fitter and stronger and have more energy in general. As tempting as it might seem during the day, drinking lots of coffee, nicotine, smoking a cigarette to help you with concentration, on the long run, caffeine and nicotine are not particularly helpful for improved sleep. So if you can, try to reduce it, try to avoid it as much as possible. And also remember to be kind to yourself. If you really need a short nap, that's okay. Go for it. Try to keep it in the early afternoon, not too late before bedtime, and try to keep it to 20 to 30 minutes maximum. Set yourself an alarm, as you don't want to end up in a deep sleep phase where you feel afterwards even more exhausted and groggy. And hopefully, with these top tips and our support, you will be able to improve your sleep quality on the long run, which also helps with pain and fatigue. Thank you very much for watching this presentation on the role of sleep in persistent pain and managing fatigue.